This is Sarnia Lambton Daily for Friday, May 8th. Good evening, I'm Terry Doyle. As we head into this weekend, the city of Sarnia has lifted a pair of restrictions. The fire ban has been lifted effective immediately. This means backyard fires, use of fire pits, and wood burning can happen again. The ban was originally put in place at the beginning of April to take the strain off first responders, who are normally called to more than 100 calls per year to deal with backyard burning. Restrictions remain in place for gatherings, with a limit of 5 people being on site at one time. The Sarnia boat launch is now open. The ramp was closed on April 14th in an effort to limit the spread of the virus and avoid gatherings. There had also been a ban on recreational boating by the neighboring state of Michigan when the Sarnia boat ramp closure went into effect. Michigan is now allowing boating as well. Now, the province of Ontario has allowed marinas to put boats in the water and get them ready for the season, but marinas are still closed to the public. Not much change in the numbers in Sarnia Lambton tonight. There have been 193 positive cases of COVID-19 overall, the same as Thursday's update. The number of people considered recovered from the virus has increased by 1. Well, it's Friday, and as we do on Fridays, we check in with Sarnia Lambton MPP Bob Bailey from the Home Office in Petrolia. And I see for the second week in a row you're working out of the kitchen. At some point, Mrs. Bailey's going to make you cook dinner. I can see it happening here.
Yeah, I get moved into here, and then that's my next job is start. What did we? What are we going to have for dinner tonight? But anyway, thanks again, Terry, for your TV for carrying what I think is a very important job that you and your staff have been doing to keep people up to date with what's going on in the community and the province. And I'm looking forward to that. We had snow flurries actually in Petrolia earlier this afternoon, and this morning. It's hard to believe it's Mother's Day weekend coming up. Happy Mother's Day to all the mothers and grandmothers out there that are tuned into your TV today.
So let's talk about Mother's Day weekend. Was, of course, the talk of the Premier on Wednesday with opening up garden centers and nurseries today, or allowing them to open up, and hardware stores and safety stores tomorrow, and then retail operations that have an outside door for curbside pickup and delivery services coming up Monday. I'm sure that was a lot of discussion among the caucus of when to do things and when's it safe to do things, but I guess at the end of the day, it's a step in the right direction.
Yeah, and people were, we've had this is about 8 weeks now. People have been, in some degree or other, have been locked down at home, unable to purchase a lot of goods and that other maybe than online. So we knew that people were aching now with the weather earlier today. I don't imagine too many people are out planting in their gardens, earlier today, but tomorrow could be another day. Saturday the weather will improve, and Sunday as well. So yeah, we knew that people were asking to be able to get back into these stores, and of course we know the store owners have done such a great job in restraining themselves and trying to help out. So we wanted to give them some hope. And as they return to business, not all businesses are ready to return yet either, because most of them were ready. They were able to put in place PPE requirements and spacing and things like that. And it'll still be curbside pickup for those retail stores on Monday. The hardware stores, as you say, Terry, will be open on Saturday for people who want to buy parts, pieces of equipment, wood items for their home, for repairs that they've been maybe putting off. So those things will be taking off as well. And of course, there was a relaxation of in the construction sector, anything to do with infrastructure, municipal infrastructure, and of course, residential construction can return to work too, so that people can start. A number of people want to go back to work there. People are waiting to get into their homes. They've made a new home purchase, or they're trading homes, or they probably have a closing date that's fast approaching. So I drove by one of the subdivisions the other day here in Petrolia, and oh God, there must have been 8 different houses under some different stage of construction, and all wearing their personal protective equipment, but everything from putting a cement driveway in to roofing to siding to laying bricks. It was amazing to see. Of course, that's all been on hold, right, for the last 8 weeks. So people are started into that already. So yeah, so it was the caucus. We have at least 1 or 2 calls a week with the Premier, and the economic recovery, and they know that people want to get back to work. And the Premier, no one wants to get people back to work or businesses open more than the Premier, because he come out of a small business background himself, and he knows how hard it was. Like, it was a lot easier to shut everything down than it is to get things going again. And I know we're also working, the marinas are able to go to work now, getting boats prepared in their buildings, or in their warehouse yards, or yards where they keep the boats. They're preparing them for a later date when they can launch them. That date hasn't been announced yet, but I know that, for example, here locally, Dave Brown and the Andy Brandt Marina, things are unfolding down there as they should, and a number of the other centers as well.
Earlier today, you met with some business community members and had a little chat, a virtual meeting, of course, with them. And I'm sure that's one of the discussions as well, is working with the remainder of the business community.
Yes, there was many people on that call from the local business community. I won't try and name them all, but everybody from the Chamber to the Sarnia Lambton Economic Partnership, SLEP, Tourism Sarnia Lambton, and a whole myriad of other business people and small business people as well. And I had my colleague from Toronto, Prab Sakaria. He's the parliamentary assistant to the Small Business and Economic Development Minister, Vic Fideli. And Prab was on there with me, and they've been doing a number of these calls around the province. Sarnia Lambton is just one of them. And we're near the front, one of the first communities to do this. So we wanted to gather as much information and data from those small business people. It was very informative. I know Prab was very impressed with the work that the local community's done already, ready to do their part, ready to go whenever they get the go-ahead sign. So it was a very informative call. I look forward to being able to speak more about it at a later date when we have a chance to collate all that information. But it was very informative.
Wanted to circle back on something you said before. We were talking about the businesses allowed to reopen this weekend. Just a one note for everybody: check with the business, because they may have decided to do things, yes. Maybe wait. They may have decided to wait a little longer before opening up. So just a quick note we'll pass along there.
Yes, it wasn't mandatory, that's for sure. It was just if you feel that you can meet the guidelines and the personal protective equipment, the spacing, the safe distancing, then you could make those own decisions. Of course, car dealerships were open a little earlier this week for in-person. You had to call and make an appointment, and you could go and visit. And of course, they were all prepared to do this. They were talking to me virtually every day, and they're ready to go. I want to applaud the work that they've done to prepare themselves. Another call I was on this week, just when you mentioned, made me think of it. Earlier this week, I was on a call with the mayors of many mayors from across Ontario, everywhere from the north to the east to this, and of course our southwest here. I had 4 mayors that have predominantly lakefront property or riverfront property. Mayors Arnold, Mayor Bradley, Mayor Lonnie Napper from Plimpton, Wyoming, and Mayor Bill Weaver of Lambton Shores, and who is also the warden of the county. We're on that call with hundreds of other mayors, and they all and the Premier was on there. It was as well as a number of cabinet and some caucus members like myself, and they all talked about what condition they were in. Bracebridge and the Muskoka area are ready. In one way, they want people to come, but yet only if they safe distance and bring their own groceries with them. Other parts of Ontario, Hull and Norfolk, they don't want any outsiders, any people from outside to come there yet, and they've kind of issued a directive in that case. And of course, the First Nations community, an important part of Ontario, have their own fears and concerns, because in some cases you have to travel through their community to get to these summer properties. So anyway, it was quite interesting.
But I guess that's going to be the challenge going forward as well, because I think the Premier talked about this on the Wednesday announcement about the places opening. It's one thing to say, okay, we can open certain areas but not open others, and then people will just travel from one area to the other. If you said, for example, I think his example was if we said, all right, Kingston towns the size of Kingston can go ahead and open, well, then everybody in Toronto could just flock to Kingston if they wanted to do things. So I've got to think that's where there is a bit of a push and pull going on.
That's right, and that's what is concerned. I think that as we go into next week, we're going to see more relaxation again. There'll be another announcement as far as that. And the one thing that the Minister of Health and the Premier stressed on our caucus call the other day was we just can't open up Toronto, because if everybody's, said everybody can go back to work tomorrow, everybody will be riding those subways, and they're packed enough as it is, in the best of times. So those people we could reinstall this virus again, and people could be contaminated and have to go to hospital. We could be going after all the great work that people have done, the people of Ontario have done to get to the point we are now, where I think we're less than 2% across the province of outbreaks. And I mean, the real problem now is the long-term care homes. So we really have to isolate them and work on that problem there. But we can't have an outbreak in the rest of the province, or especially in Toronto, where it would just multiply like overnight. So there's some big decisions to make there, and I don't envy the Premier in making them. And he always puts that proviso on there that he's working closely with the Chief Medical Officer of Health, Dr. David Williams, who, always weighs in on those decisions, with him and with the Minister of Health. But at the end of the day, the Premier, like he says, I'm going to wear this one way or the other. And so he has to make the ultimate decisions.
As we go forward, I'm sure you'll be keeping your eyes peeled on what's going on here in Sarnia Lambton and seeing how it works. And I'm sure the message is indeed. We saw how grocery stores have put things in place. Pharmacies, even the liquor stores, put in various things with the plexiglass, yep, with where you can go, what aisles to follow, the arrows. I've got to think that'll probably be the things where it's almost been the trial balloon, and then utilize some of those tips to go towards opening up other places.
Yeah, and I think that's what the information will be used as we go forward. We'll see what worked well, what didn't work in those various retail outlets, and we can hopefully implement in some form or manner that. And I noticed the medical officer of health, both provincially and in a lot of locals, is advising people, if you do go out, wear a mask, so you don't contaminate someone else. Keep that social distancing, make sure you wash your hands as much as possible with either soap or water, or with one of those hand cleaners, and just be very cautious that you don't make someone else sick, or yourself. We've come a long ways in the province, and we want to continue to do that as well.
As we let you go, 2 days you're marking: Victory in Europe Day and Jersey Day.
Yes, it's Jersey Day today. I'm going to be posting something later to my social media. I got my Sarnia Sting sweater here, so I'm going to have that posted a little later today. And I advise people, if you've got any questions or any comments, or if there's information you're looking for, go to my website, bobbaileympp.com, and we try to keep it up to date as possible with any announcements from either your TV or from the province, from the city, the county. And that's the easiest way to communicate with my office. We're working virtually. My staff are doing a great job. I want to say that for them. I hope they're watching here. Anyway, they are doing a great job. We're answering a lot of questions. We still get emails, a number of phone calls, but a lot of people seem to be using the electronic version of contacting our office, and I think that's working great.
Well, Bob, we'll let you go. I'll, when you get things going in the kitchen there, since the office is in the kitchen, and you get going with dinner, I'll swing by for curbside pickup.
Yes, happy Mother's Day again to all the mothers and grandmothers across Sarnia Lambton. I'm wishing my wife happy Mother's Day as well this weekend.
Bob, thanks very much. We'll see you next week.
Thank you, Terry.
There's Sarnia Lambton MPP Bob Bailey. Stay tuned. You are watching Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily. Let's check in with another organization in Sarnia Lambton that's a familiar name to many people, but certainly having to do things differently. That's Pathways. And here's Alison Morrison, the Executive Director, joining us now. Alison, how are you?
Hi, thanks, Terry. Thanks for having me and allowing Pathways to tell our story.
Yeah, so how are things right now? Let's go back to, as we've done with a lot of people, let's go back to mid-March. We were just getting close to March break, and then the world changed. How did things come about at Pathways at that time?
Right, so we closed to the public on March 13th, and end of day, March 16th, all of our staff were directed to begin working from home. We've been able to retain most of our staff in areas where funding continued to flow to our organization, but unfortunately, staffing in our fee-for-service areas, like our on-site childcare cache, our pool program, our family and transition support services, and our lifelong learning program were released due to work shortage. And we're certainly hoping to be in a position to call some of them back to work soon when we learn from the government and local health officials that the time's right.
Yeah, that certainly has got to be a challenge where you keep things going as much as possible. Tell me about some of the services that are still being offered, and then of course offered in a different manner, I would think, right now.
For sure. Yeah, our doors are closed, but certainly we remain available, and that's our messaging for our community. We're available as best we can during these times to support families and children who have communication, physical, and developmental challenges. Our staff have been working from home. They're actively reaching out to families with children and youth on the caseload to check in, and where we can offer coaching and therapy supports. We're talking with those families and offering them some suggestions of what they can do to keep moving forward with their therapies at home. Soon, we're launching our secure, privacy-approved platform for video conferencing, and this will allow us again to be face-to-face with clients and work with them and their caregivers. For a long time, Pathways has been trying to get out into the community and working in the neighborhoods and schools where families are living. And this has really been a big game changer for us now with having to work from home. We're looking forward to the opportunity of getting back into the community and essentially even being in the living rooms of families through video conferencing, so we can keep moving forward with our therapies.
I have to think too, especially once the video conferencing is fully up and running for both the parents and the children, just seeing that familiar face once again is going to be huge.
Absolutely. And, we've certainly been trying to get a lot of messaging and supports out through social media. And that's one of the things we're hearing back from families, how much they're appreciating seeing their clinicians and seeing the people that they had been accustomed to meeting with weekly for therapy supports, both the children and the parents.
What are you hearing from the parent side in terms of the challenges going on right now with not being able to access the services in the same way they did in the past?
Yeah, certainly our thoughts are with our families. They're also heroes in this pandemic story, working in a new world to support their child or youth with special needs in an environment where their support team is not quite as hands-on. We've got our family engagement coordinator, and she's continuing to connect with families and offer supports to help them navigate these days. And she shared that many families are having a sense of guilt and may not be feeling that they're able to support their child with their homework or their therapies in the ways they feel that they should. So that's where our team is rallying behind them and supporting them with tips and tools and encouragement, and also just with that, it's okay. Today doesn't have to be a therapy day. We are hearing that some families have really jumped on board with working on skills during this time, and hearing of children moving forward with goals and actually achieving some of them in their home setting, whether it be the youth with special needs who has picked up some of the activities of daily living around the house, and learning to do dishes, empty dishwashers, or young children that are learning to play differently with toys now, the engagement that parents are able to dedicate during some of this time at home. So we're hearing some great success stories, and we're also hearing of challenges. And our staff are certainly wanting to keep moving forward with the speech and language and occupational and physiotherapy goals that they might have. But sometimes we're learning that that's not actually what's on the minds of parents today. And where we can, we help point parents to the resources that they're needing in this community around mental health or shelter or food services.
When you mention about some of the parents, or pretty much all the parents, doing various programs and helping their children at home, one thing we've heard from various people throughout the pandemic is, don't worry if it's not perfect. Even if you're, accomplishing small things, or, sure, you see if they're working with their usual supports team and it goes one way, now working with them, maybe you get 70% accomplished. Don't sweat it, because you know what, you're still accomplishing things.
Absolutely. And you know what, so much about development is about connection. And whatever way we're connecting, through reading books, through talking about what we're seeing outside, going for walks, moving our bodies, these aren't small things. So we all are just trying to do what we can during this time, and no judging, no judging.
No, absolutely. We're all working through this together. You mentioned obviously the building itself is closed. You're joining us there as you check into the building and make sure everything's fine. But in the grand scheme of things, I've got to think this is a whole different world, especially when you're used to having the Pathway Center right there along Murphy Road. And next thing you know, everyone's having to scatter.
We are certainly missing working with our families. We're missing working with our staff face to face, certainly connecting with them and, thoughts with them as they're being cooks and cleaners and counselors and consolers and entertainers and teachers for their own children at home. They're a resourceful group. They're a nimble group. They're doing what they've always done, really, to be creative, to respond to the needs in our community. Now, though, they're managing it from home. They're working more flexible hours, evenings and weekends to get the job done. We all miss being together, and we look forward to the day that we can be back face to face. But the reality is that I think we'll be working through this virtual world for some time to come. And so lots of efforts being directed in that way.
Alison, while you may not know exactly until we move forward and able to open things up more, but in general right now, what sort of challenges do you see Pathways potentially facing down the road, whether it comes to funding and fundraising and things along that line?
Sure. Well, of course, a major impact of COVID-19 is the effect on fund development through donations and special events. And we've certainly had to cancel many of the events that our community has come to look forward to each spring and summer. Pathways certainly relies on donations and special events to help us bridge a funding gap and allows us to respond to needs in our community that exceed the government funding for our area. So, we're really worried about this. Our team's working to re-envision some events, but there's so much uncertainty there. When's the time going to be right or safe to do this? Will our community even have flexibility and funds to offer support to our organization, let alone the other not-for-profit organizations in our community as well?
On the other side, do you see where there could be some opportunities where maybe now with some of the technology and some of the virtual software, where obviously a lot of the face-to-face and hands-on things would need to continue, there could be some opportunities, maybe whether it's branching out a little further into the county or maybe more frequent visits? I'm just throwing out examples just off the top of my head, but you're looking at where maybe some of this technology could be beneficial down the road.
Absolutely. I think that this situation has caused it to pause. And while there is much pain in our community, we have to look for opportunities too. And we have to be forward facing and thinking about our tomorrow. And I think that this teletherapy will certainly become part of our way of being for some time to come. And our hope is that even in many cases that it may improve accessibility for families and may even become a preferred vehicle for service delivery. It's not going to be appropriate for all of our clients and all of the types of services that we do, but certainly some it may be a real way forward for us reaching out further in our community. It may give us more access, more flexibility in even when services are happening, potentially evenings and weekends. So certainly staying open to that. And again, Pathways, has always prided itself on listening to our community, finding what they are looking for and needing, and trying to be nimble to be creative and fill those gaps if we can.
Finally, on a positive note, what are you hearing from your staff in terms of, I'm sure just that positive, smiling faces kind of thing on the other side, end of the phone line or a video call? I've got to think that at least boosts everybody's mental health right now.
Absolutely. Anytime our staff are able to connect virtually, there's smiles, there's laughter, and there's certainly support for one another. And those conversations quickly turn to conversations about our families and hearing about how they're doing and how, again, given such pain that's happening and darkness, there's light and there's joy, and tomorrow will come, and we continue to hold that up.
Well, Alison, we appreciate you joining us. All the best to everyone there at Pathways, and we'll check in with you again soon.
Thanks so much.
There's Alison Morrison, Executive Director of Pathway Center for Children in Sarnia, joining us here. More to come. You're watching Sarnia Lambton Daily on your TV. Recapping our top story tonight, boaters and burners rejoice. Effective immediately, the city of Sarnia has lifted the fire ban and the boat launch has been reopened. Provincial rules remain in place, enforcing physical distancing and limiting gatherings. Well, that's going to do it for our show tonight. We are off here for the weekend. Of course, you can follow the Your TV Sarnia Facebook and Twitter feeds for updates throughout the weekend. Well, for all of us here at Your TV, I'm Terry Doyle. Have a good and safe weekend. We will see you back here on Monday.